I'm Scott Dartnell, RMT.
Monica Passanato for Celli, RMT.
And we are so excited to be joined by our good friend and educator, Aubrey Gowing from Ireland today, live from Ireland. Welcome, Aubrey.
Hey guys, how are we doing? The miracles of modern technology, joining you here from Ireland.
Well, we know that you have a busy day. You're always doing lots of education. You're busy with your school, and we appreciate you making time for us. This is a really important topic about therapist self-care. So let's proceed.
Thanks, Scott. Thanks, Monica, for inviting me. We've got a really exciting presentation coming up. What I suppose initially kind of sparked my interest in this was when we started to do our myoskeletal training weekends as virtual attendance. So we had students in the room and then we had people joining us virtually. I found that we were going through the techniques that we were covering on a particular weekend, and not everybody at home had somebody to work on. So what I started to do was modify. When I would demonstrate a technique and people in the room would be working, I'd go, okay, well, if you don't have somebody to work on, here's a way that you can practice this on yourself. So I started to modify the techniques, and I realized almost all of these can be modified to be self-treatment. And the other thing that really caught me by surprise was in demonstrating them to students in class, afterwards I'd be going, wow, that feels really good. You start to feel the benefits. You're going, this is almost as good as treatment. Now, I would have the caveat and say there are some techniques that you can't reach. You haven't got the range of motion to do some work on yourself. There are some techniques that you can't quite get the leverage or the angle, but they're in the minority. There's an awful lot that we can do for ourselves. The second caveat is our nervous system processes information differently when we self-treat compared to when somebody else treats us. When you work on yourself, your nervous system actually slightly down-regulates. It doesn't pay as much attention because it goes, yeah, that's just me. I know it's safe. I know what's going on. Whereas when somebody else works on us, the nervous system is much more engaged because it wants to monitor what's happening. Remember, our nervous system is always trying to protect us. As Eric Dalton says, the mama brain trying to look after us, trying to protect us, trying to anticipate. So it pays much more attention to somebody else treating you. So the work we're going to demonstrate over this presentation is for maintenance, for regular maintenance, but it's still a good idea to get some treatment for us as therapists from time to time as well. Okay, it's not a direct swap out, but this is really going to help you to maintain longevity and hopefully avoid any kind of overuse or repetitive strain type stuff. So Scott, am I okay to share a slide? Are we all set up for that?
Just give me 1 second.
Sure. I should have asked sooner. The other thing we were talking about, I don't know if anybody was on with us when we were just chatting before we were live streaming. I know there was some people in the Zoom room with us. Is I would really encourage you to ask questions. So ask questions throughout. If you want to type questions in the chat, Scott will read them out to me. As I said, if you feel brave enough and you want to come on mic and ask a question, we'll do our best to answer those as we go along. Let me just see if that is working.
1 second here, Aubrey, and we're just sharing.
No problem, Scott.
All right.
So I really encourage you to ask questions. And as we said, no such thing as a stupid question. If there's a question you have, it helps us to hone in on where there might be gaps in your knowledge, stuff that maybe I'm taking for granted that you know that you maybe don't. We might even do some little bit of anatomy review. We'll see how we get on. Let me just check that now and see if we can. No, I'm not getting share yet, Scott. But we're going to be going through a couple of different techniques. There's a few things that are useful to have on hand, but not essential. We're not going to spend a lot of time on these. So one of the things we talked about was some form of stretch rope. So if you have a stretch rope or a yoga strap, or you can use a towel, we're only going to do 1 or 2 things with this. Mostly it's going to be hands-on work. I'm going to demonstrate a little bit of what I call fascial floss. Some people call voodoo floss. I think Rock Tape have their version of this. I think do some training in it. They call it rock floss. So a lot of different names. It's like a TheraBand, but very different in its use. It's thicker. It's a narrower strip, like it's denser. So we're going to look at how this can be used for self-treatment, for self-myofascial release, which a lot of things claim to do and really don't. So we'll do a little bit on that, but mostly what we're going to focus on is hands-on work. See if we can get our share going. No, it doesn't seem to be allowing me.
I'm just trying to find you under. Did you log in under Aubrey?
Not to worry. We can come back.
Oh, we'll come back to.
What did you log in as?
Probably just Aubrey Gowing.
Yeah.
Hmm.
Of course, it's not letting me search you. Just 1 second, Aubrey.
If I do a raise hand, you might be able to see me.
Yeah,
Sometimes that pops me up to the top.
there we go. 1 second.
Don't you just love the miracles of modern technology?
Oh,
I'm just going to
whenever
share my slide just to give you a bit of overview. I'll talk through it first of all. So the first thing I'm going to do is we're going to start off very gently, because one of the principles that I always follow in treatment and in teaching is to work from superficial to deep. What really crystallized this idea for me was studying with Leon Chaito. He talked about how relaxed tissue is transparent to palpation, which means when you relax a layer, you can easily feel through it. Whereas when tissue is tight and restricted, you can't feel through it. It is opaque to palpation. So it's really important, if we start at that superficial level, to kind of gauge the level of resistance within the tissues. Sink to that level and start to treat at that level, rather than just deciding, I'm going to go in and work a third or fourth layer of muscle. So we're going to start off with a gentle technique on the neck, but I want to show you it on the forearm first. You're just going to place your hand on your forearm and drag the skin. So I want you to practice a very light contact and just pull the skin as much as you can. This is kind of sustained stretching. It kind of comes from connective tissue massage, or CTM. So we're just going to stretch the tissue in either direction. And now when you stretch the tissue, I want you to create a little bit of movement. So you'll notice I'm not sliding on the skin. I engage. There's a stopping point when the elasticity of the tissue has been taken up. So I'm going to go to that stop, and then I'm going to create some movement. So this is what really creates a myofascial release. Well, it's not really myofascial, it's superficial fascia at this stage. But by pinning one layer of tissue and causing other layers to move, we get this sliding action, which is lost as tissue dehydrates and becomes adhered and stuck. So we want to restore that slide and glide. It restores interstitial space, improves fluid dynamics, all kinds of stuff. But most importantly, it's kind of like knocking on the door for the nervous system. Instead of just going, I'm going to go deep into the body, that's like breaking down the door. That's naturally going to alarm the nervous system. Instead, we're knocking on the door. We're asking permission. Very quickly, the nervous system goes, oh, there's no threat here. And it downregulates. It starts to reduce tension. And that makes all of the tissues much more responsive. So once we've got that feeling of just tractioning the skin and creating some movement, we're going to put our hands on our neck and do a very gentle maneuver here. So I'm literally just kind of like wrapping my fingers around, and I'm going to twist the skin in one direction and twist the skin in the other direction. So nice gentle contact. Turn the skin as far as it will go. Think about like twisting a sleeve or a sock around your leg, that you just want to slide the sock. We're not working into muscles, so your hands are really relaxed. You're not hooking your fingers. There's no digging in as yet. You're literally just holding and turning. So feel for that kind of stretch in the skin. Once you've got that, what I'm going to have you do is turn the skin, rotate, and you're going to lift. You're going to draw up towards the occiput, towards the base of the skull. So turn and now move in a different plane. Remember, it's still only skin. You're not working muscle. You're not trying to decompress your spine. It's very, very gentle, very superficial. Now we're going to add some more movement. You're going to turn the skin, traction up, and just turn your head. So we're restoring independent glide between the skin, the superficial fascia, and then the fascia covering the muscle. Let's try again. Reset, torsion the skin, turn, engage with traction. You can even do little movements within that, play at the point of restriction. Now, people will say, that doesn't feel like it's doing very much. It's not. Remember, this is preparatory. This is gentle. The next superficial muscle we're going to look at is platysma. Platysma actually has pretty rich nerve supply. So calming this down helps us in getting into some of the deeper work, because we're going to do scalenes now in a moment. So what I'm going to have you do is put your hand on your chest, just draw down off your collarbone. You're going to pin platysma, and then you're going to lean the head to the opposite side. Draw down over the collarbone and lean. And this will feel like a little bit more of a stronger stretch. Now let's change up the movement. Drag down, You're going to turn your head. So you can turn to the same side. Here I'm pinning down on my right side of my chest, and I'm turning the head to the right. And you'll notice as the tissue starts to respond, it gets more and more gentle. It gets easier and easier. You feel less stretch because there's less resistance. So now we can modify the movement again. Pin, rotate, and side bend. Gently, never forcing it. Nothing should ever be uncomfortable. You should only ever feel like a mild stretch on the tissue. If you get to a point that it's very stuck, hold at that. And you can even do a little bit of teasing out, a little rotational motion, a little rock, something that just creates a bit of on-off stretch. Because this is a form of graded exposure. It's allowing the nervous system to become accustomed to something. So it goes, that's not threatening, that's okay. Let it go, and it'll relax and stretch a little further. Let's try the same thing on the other side. Pin the tissue down. Lean the head to the opposite side. So now I'm rolling down off my left collarbone, tipping my head to the right. Try not to hit my microphone. Hopefully that's not too distracting. Try rotating. So I'm pinning down off the left, turn left. Hopefully everybody's feeling a pretty good stretch on that. I can see some people have cams on, so you can give me a thumbs up. Let me know if that's working good for you. You're feeling a nice stretch. If you have cams off, you can always give us a virtual thumbs up. Always nice to get a reaction. You know, people are feeling what they should. Okay, and you can do all kinds of movement with that. So one of the nice things I like about it is it's non-specific, it's not particularly mechanical. You can go by feel. And you'll probably find that on a particular movement, you might feel, oh, that's really strong. If you practice that for a couple of days, you'll go, oh, I'm not feeling it anymore. That's good. It means it's actually released. So you can start to play around with different types of movement and see, well, what if I turn the other way and tip my head? What if I tip back? What movement still feels a little restricted? What direction am I going to work on today? So it's something that you can really play around with and go by feel rather than a specific mechanical motion. It's non-specific, nice and simple. We all happy with that? Ready to move on? Okay, next we're going to do scalenes. Now, I'm really just going to work the distal end of scalenes. Let me just check and see, are we able to share? Aha, I am. Let me just show you for a second what we're going to go through here. So we're looking at the skin stretch, which we just did. We're going to do a pin and stretch for platysma we've done. Now we're going to go on to scalenes and then multifidus. We're then going to go down into the arm. And if possible, then we'll do a little bit on kind of the lower extremity. So we'll see how we go. I'll come back to this slide as we go, but this is the one we're going to work on now, scalenes, and then we're going to go into multifidus. So do we need a little anatomy review, or is everybody pretty happy that they know what we're doing? We're all good? Okay. Maybe when we get to scalenes, if anybody has any kind of nervy stuff, we'll take a look at why is that still showing me a share? Here we go. If anybody's feeling any kind of like neurological sensations, we can look at things like the scalene triangle and stuff. So we're going to kind of work the attachment of anterior scalene mostly. So you're actually pretty far in along the collarbone. You're going to sink with your fingers down behind the collarbone, and you're aiming for that first rib. Now, here's the thing. If you hit on the brachial plexus, you'll get a bit of a nervy sensation down your arm. Not the end of the world. You're not going to die. It's not a heart attack, but it's not pleasant. It will sensitize the nerve. So if you feel any kind of nervy sensation, move. Move a little bit more medially, move a little bit more laterally. Just move off the nerve and it should be fine. So what we're going to do is sink the fingers in behind the collarbone. And then I'm going to do a little bit of side bending. So like we did with platysma, I'm pinning with my fingers. Can you see what my fingers are doing there? Pinning with my fingers and then side bending. Do that a couple of times. And then we're going to go into some rotation. Now, here's the cool thing. Clients really love this one as well. When you hook the fingers in, down onto that first rib, when you turn your head towards the side you're working, it softens the scalenes. It actually feels like it's less intense. So that allows you in a little deeper. Now turn your head away, nice and slowly, and you'll get to a point where it suddenly starts to tension. Then turn back. Pump the tissue a little bit, so I'm just compress, compress, with my head turned towards the same side. So I'm working my left side anterior scalene. I have my head turned to the left. I'm going to pump and then pin the tissue and turn away. Just until it starts to get a little bit intense. You'll notice I tend to use words like intensity rather than pain or pressure. Because intensity is the overall sensation. Particularly when you're working, like people oftentimes say, oh, I like a strong pressure. You don't, you like an intense treatment. Pressure is only one of the elements. Area, angle, and velocity are the other three areas that influence intensity. But pressure gives us depth. So pressure is useful. Pumping and stretching. Now, what you should notice is after about 3 or 4 goes, when you turn your head, it'll turn further with less restriction. This is really, really quick. Now go back to the side bending and see how does it feel. Okay, all happy so far? You want to repeat that on the other side? So we're nice and balanced. So now on the other side, the one you didn't work, start off again. You're kind of just outside the edge of sternocleido. So if we can identify the edge of sternocleido, we're outside that, we drop down behind the collarbone. And again, we're going to start off with a little bit of side bending, just kind of feeling for what's going on. If you feel a nerve, move forward or back or in or out a little bit until you don't feel any nervy sensation. If you're on anterior scalene, you're in front of the brachial plexus, so you shouldn't feel any neurological referral or anything like that. Okay, now we're going to do the rotation. So with the fingers sinking in as far as is comfortable, I'm going to turn my head to the right, which kind of slackens things off. Pin the tissue, turn left until you feel a bit of restriction, and ease back. Pump again, and turn. I change my angle here so you can see what I'm doing. So the pump is very subtle. I'm just compressing, compressing, compressing. I'm never fully letting go. Pump, 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 and turn. Turn back to the side, soften the muscle, pump. It's already feeling a lot softer for me when I turn back towards it. And as I turn away, I feel I can go further. And that's only 2 or 3 repetitions. Pumping tissues is one of the most profound things you can do. It'll change your practice. So simple, it's hardly a technique, but yet it calms the nervous system, hydrates the tissue, lets you in deeper, and then makes the tissue more responsive when you do your other techniques. Great way of dealing with ticklishness as well. If I work on an area and I'm working on a client, particularly somebody who comes in pretty acute pain, and I can't really do very much, I'll start off just pumping at a depth that they don't find too painful. And usually within 30 seconds or a minute, you can go in as normal with your techniques and they're going, yeah, it's not that bad, it's not sore. So it's a great way of calming down kind of acute flare-ups as well. Not acute injuries now, I just mean acute pain, sharp pain. Okay, we happy with that scaling work? Thumbs up? Good, okay. Multifidus. So really what we're looking at is getting into the laminal groove. So if you feel the spinous processes on the back of your neck, put your finger pads either side, and we're basically going to do the same thing. We're going to pump and stretch up. Pump the tissue. So I'm kind of squeezing in towards the neck and stretch. So there's 2 different versions that I can do here. One is I pull the tissue up as I flex forward. So I'm going the same direction as the tissue. The more intense version, what we think of as a pin and stretch or a soft tissue release, is when we pump, try dragging the tissue down towards the base of the neck and flex. So in the first version, we're pulling the tissue in the same direction as it lengthens. In the other version, we're resisting as it lengthens, which is more intense. But both of them basically encourage slide and glide between the different fascial layers. Okay, pump again, hook the tissue up and bring in a different plane of motion, bring in some rotation. Small rotations of the head, turning back and forth. A couple of times, pump it again. Stretch the tissue up, little rotations, working in just into that laminal groove, catching that cervical portion of multifidus. You are, of course, getting other neck extensors while you're at it here and neck rotators. Splenius capitis, the erectors, all those good stuff. Okay, and we can work our way kind of up and down because I'm usually using maybe kind of 3 fingers. If you can fit 4 on and they're strong, great. But you'll probably find you're getting portions of the neck. So you can start off like mid-neck, then work up a little bit, work down a little bit, as far down as you can comfortably reach. you can continue with these techniques throughout that segment. So that's multifidus. Pretty simple, pretty straightforward, right? Now, I'd always say in therapy, what you're largely doing is creating a window of opportunity where tissue is less sensitive, warmed up, more mobile, and more pliable. We haven't really fixed anything. But while it's in that state, it is more responsive. So this is a great time to stretch. Let's look at stretching the scalenes. We have 3 scalenes in the side of the neck, anterior scalene and middle scalene attaching onto the first rib, and posterior scalene attaching down onto the second rib. Why are these guys so important? Well, the scalenes are kind of like the psoas of the cervical spine. In the same way that a tight psoas can interfere with the function of the lumbar spine and cause lumbar disc herniation, tight scalenes can compress the cervical spine and lead to all kinds of radiating symptoms. So really important to release these muscles, not only to improve mobility in the neck, but also to improve nerve function, but also they are prime culprits in referring pain either down into the chest or down into the area of the rhomboids. I get a lot of clients coming in saying they've got pain between their shoulder blades. You work their scalenes and they go, oh, that's the pain I'm getting. So actually quite important for even the upper part of the trunk, not just neck muscles. So we can stretch these guys in a couple of different ways. Remember, there's always multiple ways to do all of these different techniques. I'll demonstrate kind of the simplest. So if I lean my head towards the side, I'm mostly getting the middle scalene. If I tilt my head forward, I feel it more in the posterior scalene. If I tilt my head back, I feel it more in anterior scalene. You all with me? Slightly more complicated way to do this, and I do this with clients that are more active, more physically aware, is if you rotate and side bend to opposite sides, you're getting anterior scalene. If you just side bend, you're getting middle scalene. If you rotate and side bend to the same side, you're getting posterior scalene. That one's a bit more complicated, isn't it? The tip forward and back is probably easier. So what I want you to do is bring your left ear towards your left shoulder. Feel the degree of stretch that you're getting on the right side. Tilt your head forward and see, is that tighter now? Bring it back to the middle position. How does that feel? Tilt back. Now, normally for me, anterior scalene is the tightest. I think because we've just worked it, it's not feeling that tight. For me, today, I'm feeling it more in posterior scalene. So this is, again, one that clients can do by feel. It's one that you can do by feel. You don't really have to know the mechanics. You just, where in that arc feels the tightest, that's where I'm going to focus on. Now, I like Aaron Mattis's model of active isolated stretching, where you're going to go in and out of the stretch. You're pumping, you're creating more of a fluid dynamic, a greater fluid exchange in the soft tissues, but you're also not alarming the nervous system. You're not kicking in a myotatic stretch reflex. So we're just going to hold for 1.5 to 2 seconds. So I'm going to tilt my head to the side and go forward. And I'm just going to use my finger pad, one finger on my temple, and I'm actually lifting towards the ceiling. 1, 2, and relax. Tilt the head and lift, 3, 4, and relax. So I'm using maybe 1 gram of pressure. I have to be careful because sometimes my inclination is to say ounces, and I don't mean ounces. Pounds or less, aren't they? Isn't a pound a really light measurement? Like less than a pound. So 1 gram or 2. Think about the largest coin in your currency. It's about the weight of that. So whether that's a €2 coin or a £2 coin, or I don't think you've got dollar coins anymore in the States, sure you don't? Don't know about Canada. What do you got over there, Scott? What's your biggest coin?
We have
$2 coin.
boonies, which are
Toonies.
$1, and then we have toonies, which are $2.
Okay, so whichever is the heaviest of those. or maybe your credit card bill is the heaviest. That's more psychological. Okay, so you can play around with that and see on any given day which angle or which rotation gives you the most stretch, but you're really only doing a really light contact. That's why I'm saying like the finger pad of one hand. Don't yank on the head, because if you pull on the head, what's the nervous system going to do? It's going to perceive that as threat, and it's going to tense the muscle. And this is one of the most common mistakes that I see. People conflate lengthening of a muscle with stretching. Stretching has to be passive. If the muscle is resisting, if you're weight bearing doing a stretch, that muscle is going through eccentric loading, which is actually one of the strongest training effects, strength training, not a stretch. So the muscle really has to be relaxed. So you're using the other side of the neck, you're contracting these muscles. The law of reciprocation tells these muscles to relax, and then you're just assisting to go a little deeper. It really has to be gentle. You shouldn't feel a strong stretch. If you feel a strong stretch, what you are feeling is resistance, no longer a stretch. Okay? Hopefully that's clear, not too complicated for us. The other simple stretch I want to show you is actually really corrective for a lot of different things, but it's primarily a stretch for the little small suboccipital muscles at the base of the skull. So this is the old chin tuck. And again, you're going to use just one finger on your chin just to assist you in going a little further back. Another way I really like of doing this is actually to stand with your back to a wall and you try to touch your head to the wall. Because then you can add in things like wall angels and stuff like that. So it's nice to use the wall for that one. So tuck the chin, a little bit of pressure and relax. Again, I'm not pushing very hard. The only reason you need this little bit of assist is because the tight muscle you're trying to stretch sometimes overpowers the weak muscle that you're getting to do this movement. So the weak muscle can only generate so much force. To fully stretch the tight muscle, it needs a little help. That's all. So it's super gentle, but it will increase your range of motion a little bit and give you a more effective stretch. Okay, we happy with that? Again, endless modifications we can make on that with rotation and side bending to get specific suboccipitals, because there's 4 of those little guys on each side. But a general stretch like that is going to be good for correcting, say, the leaning forward that we tend to do a lot as therapists. While we're at it, first point in terms of body mechanics when you're working as a therapist. I frequently see this, and I think it probably happens more in the learning process, because when people are learning new techniques, they oftentimes forget about what the rest of their body is doing. But I see people standing at tables and doing this, and they're looking down, and they don't even notice. And I would say, look at what you're doing to your neck flexors. You're shortening all those muscles. That is going to encourage a forward head posture, because these muscles cannot lengthen fully. So in order to avoid that, what I want you to practice doing is put your chin on your fist like this. Your fist is resting on your sternum, and now go into a lunge. So you have 1 foot back, 1 foot forward. Your whole body is tilted forward, and you can still look down at the table. But instead of doing this, where I've shortened all my neck flexors, I do this, and I'm maintaining the length in those muscles. Very simple tip, but it'll prevent you from getting this overuse in your neck flexors. Okay, that's tip 1. We'll talk about other kind of body mechanics stuff as we go along. Okay, so that's kind of for the neck. Next, we're going to do a little bit of work on biceps and triceps. Biceps typically short and tight, triceps typically weak and inhibited. So in short muscles, we're mostly going to stretch away from the body. We're going to stretch distally. We could also say we're stretching towards the insertion of the muscle. So all I'm doing is I'm using full contact with my palm and I'm pushing down towards my elbow. And I'm working in stages. I think with self-treatment, just like most of the treatment that I do, I don't use any oil at all. I prefer to get a lot of grip. So I'm not sliding. It's not really a massage in terms of like traditional Swedish relaxation, what I think you guys would call spa massage, where you're using oils and there's a lot of gliding motions. Nothing wrong with those. Love those treatments. Absolutely amazing. Great relaxation work. But if we're trying to direct fascia, it helps to have a bit more grip. So I'm working my way down. You could use your forearm as well, starting with your palm up, settle onto the body, hook into the skin, turn your palm down. So you get this kind of like a winding sort of effect. Triceps, I'm going to hook the tissue back because triceps tends to be overstretched. So with bicep, I was working away from the body. Tricep is the opposite issue for most people. It's overstretched and weak. So I'm going to pull back up towards my shoulder. Now, this is largely preparatory work, but already, I don't know if we can see that on camera, but I've got some erythema here. I've got some nice reddening. I've got some increased blood flow. But here's the really great bit. This is the part that you're going to feel huge change on. I'm now going to do some fascial bag work. I love this stuff. Eric does a lot of this for hamstrings and stuff like that and quads. So what I'm going to do is I'm going to turn my arm in, hold the bicep, and I'm going to twist the bicep in. You hold the bicep twisted in as you now turn the arm out. So it's like the tissue, all of the soft tissue of the upper arm is dragging in, while the deepest structure, the bone, is rotating out. And I can work my way down. Mostly here, I'm kind of gripping with my finger pads and the length of my fingers. So you can see the way I'm not hooked in, fingers are quite flat. So it's a broad contact. I'm getting that kind of long head of bicep. I'm going to do a different movement in a second now to get the short head. Okay, to get the short head on the inside here, I'm going to turn the arm out, push the bicep out, and roll the arm in. So arm goes out, bicep goes out, arm goes in. I'll try and demonstrate this from as many different angles as possible so that we can see, hopefully, reasonably clearly what I'm doing. So arm goes out, bicep goes out, arm goes in. Now you can start to get fancy and add those movements together. Roll the arm out, hook the bicep out. When you roll in, extend the arm. That's a strong one. If you've got a good fascial hook, that one's going to feel reasonably intense. Again, not painful, intense. If you would rate the discomfort above a 4 out of 10, remember we said there's things you can do to change the intensity. It doesn't mean reduce the pressure. First thing, slow down. Second thing, use a broader contact. Third thing, use a shallower angle of application. So if that's too intense, do the same thing, but do it slow. And you'll notice, oh, not as intense. So velocity is one of the first things I'll change when the client goes, oh, that's a bit too much. Slow down. Okay, let's do the same thing for tricep. I'm going to roll the arm in. I'm going to get on the inside of tricep here, the medial head, roll the tricep, and then turn the arm out. So the arm starts off in, pull my bicep in, roll the arm out. This one feels fantastic. Maybe not when you're doing it, but feels really good afterwards. So we're creating a lot of novel nervous system input, which really helps to dampen down pain response. Let's try that going the other way. So we've got the medial head here. Let's look at how we're going to get the lateral head. So I start with the arm out. I'm going to twist the tricep in and turn the arm in. Arm starts off out, pull the tricep, roll the arm in. Again, I said we'll try and look at this from as many views as possible so you can see what I'm doing. So start with the arm up, pull the tricep in from underneath, and then it's like an arm wrestling move. And again, you can combine that. You can start not only rolling the arm, but start bringing the fist in towards you as well. See the way it's the opposite? With bicep, we were straightening out to lengthen. With tricep to lengthen, we're bringing the arm in. We're creating more elbow flexion. Okay, getting down into the forearm. We're going to hook the tissue, pump our way down. And again, all the time my draw is down. Now, if I'm at the end of a therapy day and I'm driving home and I'm stopped at the traffic lights, I'll oftentimes do this work just with my arm like that. It can be easier sometimes to place your arm on something and you can really relax the arm you're working. You can lean in a little bit more and that will sometimes get you a little bit more contact. Okay. Getting down into the palm, close your fingers, pull the tissue towards the wrist and open your fingers. This is for your palmar fascia. You're doing a lot of gripping. Palmar fascia can really start to adhere to the tendons, the flexor tendons for the fingers. You can use thumb. Let's see what way can we show that. So all the time, my pressure, my drag, my hook is away from the fingers. Fingers start off curled, shorten position, hook and lengthen. Okay. You can even do this along the fingers themselves. Pull towards the palm, bend and straighten. So you curl the finger, pull towards the palm, straighten the finger. Okay. In a lot of our workshops, we get in and we mobilize each of these little interphalangeal joints. You can do a bit of self-treatment for that, but we won't spend too much time on that today. I'm going to go into the extensors and I'm going to do a little bit on the dorsal fascia. So we said for the flexors, we work down because they're tight. Again, we're working distally. Extensors tend to be weak, so we're going to work proximally. So this time you're going to work from your wrist up towards your elbow. Again, you can do this with the hand resting on the table. You find it easier. You can, of course, when you're using working the flexors, you can use your forearm. Extensors is a little bit tougher because you're trying to pull. I find it easier to use my palm when I'm working my extensors. And again, I can go with it, extending my wrist and fingers as I pull towards the elbow, or I can go against it, curling into a fist as I work up towards the elbow. Both of those create a nice fascial glide. Now, this next one is awesome for the palm or for the dorsal surface, but it can be a little sensitive. You're going to put your palm on the back of your hand and you're going to hook the tissue towards your wrist. So you're going to pull this way towards your wrist and then curl your fingers. This one can be pretty intense. So I'm hooking up on the dorsal fascia and curling my fingers. Awesome. Okay. Then I'm going to do a little bit of joint work. Now, I know in some jurisdictions, they don't like massage therapists doing joint work. I don't know what the situation is with self-treatment, but this is one that I really felt helped prevent me from getting cramming of the carpals and displacing a carpal or getting any kind of a subluxation. Now, what I would do is I would use one hand to hold, like I'm trying to pull my left hand away from my shoulder. And then I pull back with that left shoulder. So I'm actually creating joint space. I don't know if you can see the skin dimple when I do that. No, light's not quite catching it right. Anyway, so I would pull and then gently mobilize. So I'm pulling down on my left hand, pulling back with my left shoulder, and then just small movements, not big movements, because you don't want to pop a carpal out. You don't want to create too much ligament stress. It's just while you've got a little bit of distraction, you create just a little motion. Okay. And like I said, I would oftentimes do this, stop the traffic lights. I would put my hands between my knees so I could hold it and I would pull. But you have to be careful doing this in the car or on the bus because people can only see here and you're going, it looks like you're doing strange things. So try not to do that in public. Or at least try and hold your hands up where people can see what you're doing. Okay. Now, there's a lot more mobilization you can do. This is just a very brief routine that I would do frequently myself. If you have other techniques, you can absolutely add into that. I would also add a little bit of stretching. Oh, the other two stretches I would do is for my forearm flexors and for my finger flexors, because these guys get so much work when we're doing therapy. So here's the best way to stretch your wrist extensors first. So I'm placing the other hand. So I'm working my left hand again. My right hand, I'm going to put my thumb across the dorsal side of my wrist. So my fingers are on the palm side. All this hand, the right hand is going to do is pull. This right hand is decompressing my wrist. So I pull and then I use the extensors to reach down towards the floor. 1, 2, and relax. Pull, reach down, 3, 4, and relax. Pull, 5, 6, and relax. So typically I count to 20 in twos. And that gives me, because a lot of people say, oh, I'd normally stretch for 20 seconds. Well, I am stretching for 20 seconds. I'm just doing it in twos. Okay. So that is a really safe way because you're decompressing your carpals, as opposed to what a lot of people do. They put their hands on the ground and they lean forward. There's a lot of compressive force. Feel the difference if you just push back like that. You feel like your wrist is kind of getting jammed. Whereas when you do that, there's no sense of pressure in the wrist. The other advantage is you're using that law of reciprocation again, that as the extensor muscles are contracting, the nervous system will tell the flexors to relax. So not only are we physically lengthening those muscles, we're actually using the nervous system to alter the tone as well, which makes the stretch much more effective. For the fingers, I'm actually going to keep my wrist neutral. Again, I'm going to actively reach back. And with the other hand, I'm just going to assist a little bit. Actively reach back and assist. So I use my left arm extensors, finger extensors, and then my right hand just helps me get that last little bit of accessory motion, the little bit of movement that my weak extensors can't quite get because they're weak, but the flexors are capable of lengthening into. So I actively extend, keep that active engagement, assist gently. Again, just an ounce or two of pressure. I'm going to say a gram or two. A $2 coin worth of pressure. Don't yank on your fingers. Okay? All happy? Any questions so far? How are we getting on, Scott? Because we've We're about halfway through.
We just actually, Cindy, you said great tip for keeping the head neutral while working over the table, but I just loved that hand stretch that you did previous. It's like, oh my goodness, I couldn't believe it. All these stretches have been fabulous.
Good. Now think about, if you've just worked one arm, this is what I always get clients to do after I've done treatment on one hand. I go, how does that feel? And they go, oh, that feels amazing. Compare it to the one you haven't worked. You'll probably find there's a pretty significant difference. Now, if you've been chopping and changing and you've been working both sides, you're not going to notice that so much. But I find a lot of clients are like, oh my God, it feels like there's just air pumped into the hand. It feels so light. Because the tissue isn't as tight, it isn't as compressed. So it feels lighter. Okay, so the other thing I was going to look at is a little bit of fascial floss. So like I said, I'm just going to demonstrate this real quick because people love foam rolling. Foam rolling is good, but I was working it out one time, going by the recommended time frames. If I was to foam roll my upper and lower extremities, it would probably take me about 45 minutes. With fascial floss, you actually get more compressive force. You're taking in the whole extremity in one go. So I think this does what a roller does faster, and it does additional things that rollers oftentimes claim that they don't really do. A little trickier to do for yourself than it is to do on somebody else, but I'm going to take a hold of this. I'm going to work my upper arm. So I'm going to put a tension on this, wrap it around. Once I've got it around one bit, I can kind of let go. Now, when I'm wrapping this, it needs to be quite tight, almost to the point of discomfort. It's pretty intense. So it's squeezing out all of the old tissue fluid. It's creating a pretty strong neurological response. I'm overlapping so I don't pinch the skin. But I do want this to be really, really tight. Now, normally if I was doing this on a client, I would tuck part of the end of this into something else. Because I'm doing it on myself, I'm just going to hold it. And basically what I'm going to do then is do movements. And you really have to feel this to appreciate how strong this is. Really is incredible. Now, watch what happens to blood flow in my hand. When I squeeze, look at how much capillary refill is diminished. There's no refill yet. It's really, really slow. So I do open chain movements, which means I'm moving my arm. Then I'll do closed chain where I like hang out of a chin-up spar and I'll do different motions. If I'm doing this with a client, I'll traction their arm. You can also do the kind of the fascial hook and twist that we were doing. It's really strong when you do it with this on your arm. Now, after about 45 seconds, you go, that's getting really uncomfortable, take it off. You take it off straight away. And you'll notice the blanching, the whiteness of my arm compared to my forearm. Oh, it's coming back already. Okay, we can quite see that. Now, blood flow is way, way better. But this feels like I almost don't have an arm. It feels like a phantom limb. It's so light. The disadvantage with this is you then have to roll the band each time. So that's why I usually have 4 or 5 of them on hand, because it's pretty time consuming. I'll demonstrate that on the thigh as well, but you can basically do the same thing on the forearm. And you have it on for about 45 seconds. So you can do both arms and both legs in a couple of minutes. You can do it more thoroughly, more effectively, create movement, create fascial shear compared to the 45 minutes of foam rolling. I'm not against foam rolling. I think foam rolling has its benefit. It really does help with tissue reperfusion, that kind of hydrating of the fascia in particular. So it's not that foam rolling isn't good. The other thing is foam rolling tends to be done way too aggressively. People cause pain, which causes muscle guarding, and they go, oh, I want it to be more and more painful, and I'll try and rest my whole body weight on a pinhead. It's not good for you. Foam rolling, if you're going to do it, you should not be weight bearing. If you're interested in that stuff, now it's very different. It's far, far better. I would recommend Sue Hitzman's work, Melt Method, some of you are probably familiar with. She would die if she heard me refer to it as foam rolling. Ah, somebody's got their bendy foam roller. Awesome. Ah, Libby, how are you doing, Libby? Yeah, so totally different. If you want to actually make the best use out of the paradigm of using a roller, Sue Hitzman's Melt Method is amazing because she uses a specialized roller. Soft, it's bendy, but also she shows you how to actually hook fascia, very similar to this, how to mobilize the tissue. So it can be done really well, but what I see practiced in most gyms and stuff and most clients telling me isn't practiced particularly well. See how slow it is to roll that? It takes a minute. Okay, So next we're going to look at, another element of good working posture. So we talked about the chin. The other thing I would say is that you should generally be using body weight, which means your elbows should actually be straight most of the time. Your hands should be either side of your sternum. So you really need to think about, when I'm talking to students about this, I would say, think about where your hands need to go and orientate your body towards that. But then line everything up around it so that you have good body mechanics. So do place your hands where you need to go, because what do most people do? They stand by the table and go, oh, I need to work the shoulders. Now I need to work the low back, and now I need to work the thigh. And it's like they're rooted to the spot. You are not Groot. So you are not a tree. Move. What you should really do is, where do my hands need to be? How can I then position my arms so that I have stacking of joints? That force comes from my body movements down through the bones. All the muscles are doing is stabilizing joints. They're not generating the force for treatment. Your body weight is doing all of that. So once you've figured out where your hands need to go, straighten your arms, and that will tell you where your shoulders need to go. Then place your feet in such a way that, let me tilt the camera down a little bit, that what I aim for, I'm in bare feet. I'm never in bare feet treating or teaching. This is just because I thought we were going to do some stretching on the table. We'll see how we get on. Your hips and shoulders should always be pointed in the same direction. So you're not rotating, you're not flexing, and you're not translating the spine. So you point your body in the direction that you're going to be working. But see the way automatically when I rotate like that, that foot drops back. Because what I'm aiming for when I go to work is that I have a straight line from my ankle through to my shoulder, and then a straight line from my shoulders down to my point of contact, whether that's my palms or my fingers or my thumbs, whatever it might be. So straight line of contact to thumbs, straight line of contact to fingers, straight line of contact to palms. Body weight then does all the work. So really what you're doing is moving your ankles. Pretty simple, huh? Not overly complicated, but we sometimes, because there's nobody in the clinic room to remind us, we forget that and we just get focused on what we're doing and we end up doing nose massage. So think about your body mechanics. That's going to be one of the biggest things that is going to offset the likelihood of any kind of repetitive strain or overuse. Okay, so where were we? Demonstrate the principles of good working posture. We've done that. Active isolated stretching for multifidus, QL, and hip flexors. So the other thing people complain about is therapists will say it's either thumbs and wrists, which that good working posture should take care of, necks and shoulders, or low back. An awful lot of therapists get low back issues. Multifidus actually controls the functioning between individual segments of the spine. And I think is far more relevant for people getting compression, whether it's like a scoliotic pattern or a locked open, locked closed facet. So keeping your multifidus working properly is going to be really important. So we're going to do a simple rotation. So probably easiest to sit down for this because that's going to anchor your pelvis. If you're sitting down, you're going to keep your pelvis pointed in the same orientation. You're then just going to turn your shoulders. So you can do this maybe with your hands on your shoulders so you can monitor how far can you turn. 1, 2, and come back. 3, 4, and come back. Nice, simple rotational exercise. When I'm doing this standing, what I usually try to do is if I'm turning to the left, I actually try to push my left hip slightly forward. I try to counter rotate that way because the tendency is to let the hip go with the shoulder, that as you turn left, your pelvis will try to point left. Instead, when I turn left, I try to turn my pelvis slightly to the right. So you can do this standing, but people are more inclined to cheat it when they're standing. And that's why I usually recommend for clients that they start off doing this sitting. You can then repeat the same to the other side. Now, with therapists, if you tend to stand on the same side of the table a lot and you're always rotating to the one side, what you'll probably find is that you rotate easily into that dysfunction. But when you try to rotate the other way, you don't rotate very far. Check it for a moment. Rotate as far as you can to the left and see where are your shoulders in relation to your hips. Now rotate to the right and compare. If there's a noticeable difference, I would suggest that you only do one-sided stretches until that is balanced out. So if you find you turn really far left, no problem. You try to turn to the right and you're a bit restricted. What I would recommend is just doing the right rotations for oftentimes just 3 or 4 days. It corrects pretty quickly. Once you feel the range is really improving, recheck. When you're symmetrical, when you've got about the same amount of rotation in both directions, then you can do the stretches to both sides. Same is true for our next muscle, quadratus lumborum. We have a QL on either side. And for some people, QL on one side is much tighter than QL on the other. So we can do this by side bending like this. I find, again, when people do this standing, they're inclined to let their hips shift to the side, and that gives them a little bit of a cheat. They actually bend further. So you can do this sitting in a chair and just see how far down the side of the chair can you reach? How far down can you reach on the other side? Does one side feel easy and the other side feel difficult? If they're both the same, stretch both sides. But if one side feels really restricted, you're not getting very far, there's a real sensation of tension, then just stretch that side until things are balanced. Now, one of the things I like to do for this is to avoid substitution patterns, because a lot of people, when they side bend, they'll only go so far, and they'll go further by introducing something like rotation or flexion. Let me show you what these look like. If I practice this by a wall, hopefully you guys will still be able to see me okay. Lights aren't catching that too much? No, okay. So if I side bend and keep my hips and shoulders against the wall, I really can't cheat it. Because what most people will do is when they side bend, they'll rotate and one shoulder will come away. Or they'll substitute flexion for side bending and both shoulders will come away. So it's a way of just improving your discipline, making sure that you are just side bending. Now, I know there's probably people out there that will say, well, a really good way to stretch QL is to rotate 45 degrees and side bend. That is true. But if in the early stages, you're just trying to restore balance and equalize the gap, say, between the rib and pelvis on one side and the rib and pelvis on the other. Is our camera gone slightly offline? No, we're okay. Room looks slightly crooked. How's that looking for you guys, Scott? All good?
Looks good.
Looks good. Okay. I'm such a perfectionist about these things. Okay. So that's a nice little QL stretch. But again, there's many different ways in which you can do this. There's a lot of really good therapist assisted stretches that I love. These are just samples of things that you can do. If you've got a stretch that you use that you like, by all means use that. But try that Aaron Mattis method of going in and out of the stretch, that you're not incurring a momentary tensing, this myotatic stretch reflex that lasts about 17 seconds anyway and negates a lot of the time that you're holding your stretch. But also when you hold in a lengthened position, you are actually compressing all of the capillary bed and you're slowing down fluid exchange. You're not stopping, you're not inhibiting, but you're slowing down a little bit. Hip flexor is another big pet stretch of mine. I love this one. And it's one that people don't always get right. I actually had a therapist in with me recently and she was shocked. She was going, I've been doing this one for years and I haven't been doing it right. If you're going to do a stretch, make sure you're getting the most out of it. Make sure you're doing it right. So the stretch for your hip flexors, sorry, I keep messing with the cameras. Just as I move back, I want you guys to be able to see what we're doing. Okay. The stretch for the hip flexors, most of us know this, where you kind of roll your pelvis and you lunge forward. We all familiar with that as a hip flexor stretch? What we might not be aware of is the angle of the leg will actually slightly favor one hip flexor over another. So if I go to do the lunge and my foot is in closer to the midline, I'll feel the stretch more on TFL. If I bring it out a little bit, I'll feel it more on iliacus. Think about where the femur is pointing. TFL, iliacus. When it's directly under my hip, it's more rectus femoris. And if it's out a little bit from the midline, now look where the femur is pointing. In towards the line of psoas, where we find psoas connecting in towards the spine. Okay, so that's one thing, the position of the foot. Now, again, there's no right or wrong. Like with the scalene stretch, you can practice different positions at different times and see where's tight for me today. The other thing people will do is they'll go, oh yeah, I can go way into this stretch. Look, oh, wow, great stretch. And you go, but look at where your femur is in relation to your torso. You have got zero hip extension. So when we tuck the pelvis, when we go into this posterior pelvic tilt, you want to lunge forward and really actually get some hip extension. Okay, second point. Third point, and this is the one most people miss. What did I say at the start about a stretch? In order for a muscle to be stretching, it has to be relaxed, which means non-weight bearing. Stand up for a moment if you can and practice this, and you'll see when you go to do this stretch, you probably have a certain amount or even most of your weight on the back foot. What I want you to do instead is bring that forward foot underneath you. Practice that when you lunge, you can actually lift that back foot off the floor, that I don't have any weight on my back foot. Let me tip this down again for a sec so we can see more what my feet are doing. So my weight is on my front foot. When I do the posterior pelvic tilt and I lunge forward, there's so little weight on that back foot that I can actually lift it up and still balance. Okay, so you really want to have the weight on the front foot. And then my last tip for making this actually effective is I want to contract my hamstrings and my glutes. Those are my hip extensors. If I contract my hamstrings and glutes, that activation helps my hip flexors to relax and makes my stretch more effective. See what I mean about there being a lot in this stretch? For such a simple looking stretch, there's a lot to getting it right. Try bringing your foot out a little bit. Bring it under the hip. Bring it in closer to the midline. And see, where do you need the stretch? Because maybe it's not your psoas. Maybe it's your rectus needs it more. Maybe it's your TFL. You don't need to know which one is which. You just play around with the angles and go, that one feels like it's more restricted. That's the angle I'm going to stretch at today. Let's do that for the full duration. We're going to do this up to 20. So weight on the forward foot, tilt the pelvis, contract your glutes and hamstrings, and let your pelvis travel forwards. 1, 2, and relax. Tilt, contract, lean. 1, 2, and relax. Tilt, contract, lean forward. This is 5, 6, and relax. Tilt, contract, 7, 8, and relax. Tilt, contract, 8, 9. Is that no 9, 10? And relax. I'm losing count. Scott, you want to keep count for me? 10, well, 11, 12. Again, 13, 14. Again, 15, 16. Tilting the pelvis. 17, 18. Last go, tilt the pelvis. 19, 20. Really making sure you're firing those hamstring and glutes. I don't know about you guys, but already that feels easier. I notice a difference. There's a feeling of space. It feels lighter on that side of my body. Now, for some people, one side might be more restricted than the other. Now, how many of you noticed when you did that, it didn't feel like a quote unquote strong stretch? It felt like you were working harder because you're actually using the antagonistic muscles, but you didn't feel a huge stretch in the front of your hip, right? You might have felt a little bit of fascial pull, slight restriction, but you didn't feel that massive pull when you're overstretching, when muscles are actually tensing and guarding. Hopefully, anyway. Lastly, I'm going to take a quick look at a stretch rope because I know we're on our feet a lot, so we tend to get a certain amount of tightness in our calves. So I want to take a look at a quick calf stretch. Now, again, I get clients coming in and they say, oh, I do stretch my calves. And I'll go, yeah, why are they tight? You're either not stretching them properly or you're not targeting the correct portion of the calf. So we're going to take a look at how to target the distal end, the proximal end, the inside and the outside. So we're going to cover all of the calf when we do this, not just the calf. This is where you can use a stretch rope or you can use a towel. But like with the assist that we did on the scalene, the stretch rope is going to just be used to add a very tiny little bit of accessory motion. So the advantage with a stretch rope is I can form this kind of noose. I can make a loop that I can put around my foot. And it just secures it nicely in place. Yoga strap will do the same thing. Now, with me sitting up, I'm going to feel this more at the back of the knee. This is a proximal end calf stretch. Watch how little tension I'm going to put on the stretch rope. I actively dorsiflex and then just a pound or two of pressure and relax. Actively dorsiflex, assist with just a little pressure, see that I have fingers and thumbs, and relax. Dorsiflex and pull. So that gets more the proximal end of the muscle. If I lie down, hopefully I won't dislodge my mic pack, we'll see how we get on. If I lie down and do exactly the same movement, dorsiflex, assist, I feel that actually just above my Achilles tendon. So this is focusing more on the distal end. If I turn the foot in and do the same thing, I'll feel it more on the lateral portion of my calf. If I evert and dorsiflex, I'll feel it more on the inside, and I'll get kind of posterior tib a little bit as well. Okay? Now you can combine that. So I can lie down and I can get proximal, central, proximal, lateral, proximal, medial. I can then sit up and get distal, central, distal, lateral, distal, medial. So see the way we can actually really break it down into 6 stretches or 6 zones within the calf that we're stretching. We can be very, very prescriptive because most people are going to have a lot of tightness on the outside of their calf. You've probably noticed that from working. It tends to be the lateral belly of gastroc, the lateral fibers of soleus, and then underneath the posterior tib is kind of central. To get posterior tib, I'll just briefly, because we've mentioned it, I would do something similar, but I would actually bend the knee. So I'm going to actively dorsiflex, evert, grab the little toe side and just give it a little stretch. 1, 2, and relax again. I'm using 1 or 2 fingers and it's only a little assist. Actively dorsiflex and evert. So I'm using my anterior tibialis, my fibularis muscles. Those guys are activating and it creates a reciprocal inhibition that helps me to relax and stretch my posterior tib. Some of you might find your ankle is a little bit jammed up. We've actually got a class coming up in corrective manual therapy. We're going to do an hour-long class on restoring the talar function. What else? We could do fascial floss for the thigh, but I'm conscious that we're probably running a little long. How are you guys doing for time? You okay, Scott?
We are doing great.
You're doing great. Any questions so far?
I think everybody's just loving the stretches. I see everybody's taking part, so.
Good, good. Well, do people want to see the, I suppose the fascial floss is kind of the same for the thigh. The main difference I would say is I tend to use a slightly thicker floss, but the principle is the same. I'm basically going to wrap it around my thigh. I'm going to do some of that kind of fascial rolling movement where I can turn my leg, twist the fascia and turn out, turn the leg out, twist the fascia in. But while I have my leg wrapped, then I'm going to do some squats as well. So that would be open chain movements if I'm lifting my knee, closed chain if the foot stays put and I'm squatting up and down. But all of those are creating motion. So the compressive band is pinning some of the more superficial layers as the movement of the muscle gets some glide going on those deeper layers. Don't know if you guys want to see that. It's the same principle as we just did on the arm. Any comments on that yet, Scott? Or
I think everybody's just really enjoying this, Aubrey.
okay. Now that's pretty much all of the kind of the main areas I was going to go through. Does anybody have anything that they want to ask about or anything they'd like to see demonstrated? Any recurring issue that they might have that hopefully we could provide a bit of guidance on? Feel free to pop some questions in the chat. Scott can call them out, or like I said, if you're feeling brave and you're in the Zoom as opposed to being on Facebook, because I don't think they can chat to us on Facebook. They can probably type, but shout in with some questions if you have them.
I encourage anybody, if you have a question, please just unmute yourself and Aubrey would be more than happy to answer it for you. Oh, we had Tracy Williams to everyone. Upper traps are always sore. Any recommendations?
Okay, this is a really interesting one because for a lot of people, it's actually levator scapula. I recently wrote an article for one of the massage magazines in Australia, and it was called Levator Scapula, Hero or Villain? Because a lot of clients go, oh, this guy here. I had one client and he was like, El Diablo. And I was like, no, no, no. Levator is not the villain in this story of shoulder pain. All of the tight muscles, particularly your bicep, your pec, your anterior deltoid, your coracobrachialis, they're all dragging the scapula forward and down into this pivoting kind of motion. Levator scapula is the hero valiantly trying to hold onto your scapula and stop it from sliding all the way around to your sternum. So it's the hero of this tale, but it's a pain generator because during this struggle, it experiences a lot of tensile load. It gets quite ischemic and as a result develops some pretty nasty trigger points. So what I would suggest to you is feel for that knot. Walk your way along the spine of the scapula. When you get to the root of the spine of the scapula, go up a little bit and see, do you feel a knot where levator is? Okay. Now, usually in class, I'll then reposition the person's scapula and they'll go, oh, the knot's gone. But you can do this for yourself. Just bring your shoulder blade. Imagine you're putting your shoulder blade in your back pocket. Now feel for the knot. You notice the change in texture? Now, if we can get the load off traps, or levator scapula, whichever one is problematic. If we can get the tensile load off them for long enough, trigger points will spontaneously resolve, fluid dynamics improve, tissue tends to soften and normalize, and even if there is excessive fibrosis, because oftentimes levator is fibrotic, because the constant tension on it, the constant tensile load, creates a stimulation of the cells that build collagen, because collagen makes tissue tough. So the more stress, the more collagen gets laid down. Excessive collagen fiber, excessive fiber, fibrosis, will result. If you can get the load off those muscles and keep it off for long enough, the body will actually break down those excessive collagen fibers. So it is entirely reversible. So how do we get the load off and keep the load off? Stretch the tight muscles in the front of the body. Do a little bit of strength training for the weak muscles in the back. Improve that postural position. Then you will no longer have a painful levator scapula. Hopefully that answers that question. So really, it's not traps and it's not levator that are at fault. I mean, for the first 10 years of my practice, I probably did what most people did. I go, oh yeah, levator, beat up the tissue. And what would happen? You'd get an increased blood flow. You'd get some softening of the tissue. You get a lot of neurological stimulation, and the person would go, oh, it was really sore, but it feels good now. But within 2 or 3 days, the problem is back, because you're symptom treating, you're not eliminating the cause, because the person is coming in like this going, oh, this is tight, this is tight. You rub, 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 and they go, oh, that's better. Oh, it's tight, it's tight. What we really need to do is improve the position so that there isn't tensile stress. Does that make sense? Because that was something that took me a few years to figure out, and I stopped beating up levator scapula. Because like I said, he's the one valiantly tried to hold on, and what do you come along? Start punching him in the head. Poor old levator. Any other questions, Scott? Or hopefully that answers that. If you want any elaboration, please do pop in more.
Aubrey, I got a question for you.
Sure.
First of all, the scalenes are the psoas of the C-spine. Is like, that blew my mind. So thank you very much for that one.
I was so good at, I came up with that a few years back, and then I heard Tom Myers say it, and I was like, oh, I'm not the first one.
I suppose my question is, a lot of the work that you were doing with the arms, with the multifidus, all that prep work, the fascial pin and stretching. I suppose on camera you were standing for that. Would you do any of that sitting or laying down?
Oh yeah, absolutely. So self-treatment lying down can be really good, because then the muscles aren't working to hold your head up. Seated can be useful just for changing neural input. Your muscles are still holding your head up, so functionally it's not making a massive change, but neurologically it changes people's perspective. I mean, anybody who does neural work will know this. You lie somebody down, you get a different range of motion, you know. So seated can be useful just for getting over, let's say, nervous system assumption. Let's put it that way. So seated can be useful for that, but lying down actually means the muscles are no longer weight bearing. So yeah, that's a really, really nice way to do it. The reason I don't tend to demonstrate that is because if I'm lying down, you can't see where my hands are going. that's the main reason. And I suppose often like I said, I'm doing a certain amount of this self-treatment in the car on the way home, not while driving. Obviously, like when I'm stopped at a traffic light, I'll do a little bit of self-treatment. But yeah, lying down is probably the most effective position to work in for a lot of that stuff. Yeah. Good point. Good. Happy with that? Anything else we want to ask around that, Ryan? All good?
Oh, that was great. Thanks.
Awesome. Yeah. That scalenes being the psoas of the neck, when you look at the angle and what they do, it really is very similar to psoas. When they get short and tight, they're pulling the vertebrae. When you try to straighten up, it creates compressive force. And what are the most herniated discs in the body? The lower lumbars and the lower cervicals. Same thing. So yeah, I think we developed a series called the Essential 8, where we did 4 different kind of modules. And we looked at what are the most commonly problematic muscles, the most predictably dysfunctional. And really what I looked at it as was, if I could only treat one muscle to have the broadest impact for the greatest number of clients, what would that one muscle be in each body part? And in the neck, without a doubt, scalenes are my answer. And if I really had to be specific, if I had to get down to the minutiae, I'd say anterior scalene would be my muscle of choice. Yeah, good point to raise that up. Thanks for that. Anybody, anything else we want to ask? Anything you want to raise, Scott?
Well, all I want to say is that I learned so much today. My hands and my arms feel fantastic, and I'm all limbered up to treat clients this afternoon. So really appreciate that. Just an absolutely wonderful job on the presentation, Aubrey. And again, we really appreciate you taking part in the One Concept Canadian American Massage Conference, September 24th to 26th. We're going to be we're leading off with you first thing in the morning, right? So that's just amazing. So thank you again, my friend.
I'm looking forward to that. Yeah, that presentation is going to be quite different because that is therapy based. So we're going to be doing much more work on lower leg. That's tibial trouble I'm doing, isn't it?
Tibial trouble.
Tibial trouble. Yeah.
That's great.
So we're going to look at that posterior tibialis. And one of the other muscles that is, if I had one muscle to pick that was going to influence knee pain, that's the muscle we're going to be covering in the conference. So definitely get your tickets if you haven't done so already. There's such an amazing lineup. How many presenters are we up to at this stage, Scott?
We have 32 presenters, including yourself. Yeah.
Some amazing people. The presentations last year were phenomenal. So really looking forward to seeing what everybody else is doing. The massage nerd in me is just salivating at the idea of so many presenters.
Well, we really appreciate, again, you participating this year, and hopefully sooner than later, we'll all be together and be able to do this in a room and talk about our exploits over a pint, you know.
Excellent. That's the important part.
Again, thank you very much, Aubrey. This is going to actually be repeating and streaming on the Massage Therapy Academy group page. There may be some questions. I'll just ask everybody, if you have some questions, to put them on that page, and Aubrey will do his best to answer those.
And then
I'll share my slide as well, just so you have an idea of the sequence. So I'll stick that up there as well, so you guys can find that slide that I was just showing.
This will be available on
the channel section.
On our channel section of the conference. Once the conference starts, this will be available for people to replay. Yeah.
Excellent.
Wonderful.
Well, thanks very much, Monica and Scott, for the invite. And thank you to our audience for joining us, both here in Zoom and on Facebook. Looking forward to seeing you guys all again soon.